The injury report on the Pat and Aaron Show, presented by Florida Orthopaedic Institute in partnership with Tampa General Hospital. And joining us for the first time this season, we spoke with him before and happy to have him on again. We welcome to the show Dr. Jeff Kannen. Dr. Kannen, thanks for joining us today.
Hey, guys. Thanks for having me today.
So let's get right into it, and let's start with Marquise Brown. At first, it looked like he suffered a potentially season-ending foot injury, but now we find out small, non-surgical fracture. Should be back and healthy in about 6 weeks or so, which is a big change. How did they determine that, with obviously having at first some expectations that it was going to be worst-case scenario to changing it pretty quickly?
It depends on kind of where the fracture is. I'm not sure exactly where they found it, but certain bones tend to not heal well. So if there's a break in the bone in a certain area that might not have as good a blood supply, that might be a surgical indication. Another reason would be if there's if the fractures move or shifted or out of place, that oftentimes has to be put back in place with surgery. So that kind of determines if they're due surgery or not. He should be recovered after about 6 or 8 weeks. That's usually how long it takes a fracture to heal if you don't treat it with surgery.
Do you ever have a different diagnosis as far as what you should do for a patient based on who the patient is, whether it be that they're an athlete and they're trying to get back to play their sport, whether that be high school, pro, or any level, or whether they're just, somebody who's not an athlete and they're just trying to get back to normal life? Is it sometimes that you may or may not need surgery based on how you live your life and the kind of patient that you are and the age that you are?
Yeah, that's definitely true. Your physical demands, I would say, with certain sports, your demands are higher, and you need to have parts of your body that are functionally, completely normal. So if you have an injury and you're an athlete, or a professional athlete, they tend to be a little bit more aggressive with those. If you're someone who just likes to enjoy things and be active, those are still, options available, but we tend to be a little bit more conservative.
Let's get into the Carson Wentz injury. He's going to be out for about 4 to 6 weeks. He had a fractured ring finger. He got the surgery. For me, when I see these injuries, so like Dak Prescott and these finger injuries, Aaron Rodgers dealing with one of them right now, to me, for a quarterback, especially on the throwing hand, the pressure that you're applying to the finger, like 4 to 6 weeks, just to me, it's I don't even understand how that's possible. What do these finger injuries look like, and how do they really recover so quickly when they have to really grip that football?
Yeah, it depends on where the injury is again. I don't know exactly for his. Being a ring finger on his dominant hand, that is important, especially in a quarterback. And if it's a kind of a non-displaced fracture where it's in the middle of the bone or the shaft and it's not near a joint, those tend to heal very quickly. You're usually only in a splint for a couple weeks, and then you usually want to start moving the finger and getting your motion and your strength back while the bone continues to heal. So that's why they give the recovery time of about 4 to 6 weeks. Because usually by that time you have pretty much full function of the hand and you're just continuing to work on strengthening.
Doctor, do you consider the thumb a finger?
Yes, I would.
What's the big debate with that?
Is there one?
There is.
I consider it a finger still. It is a little bit more mobile than the other fingers, but technically it's still a finger.
Is this the case where, like, it's a debate for morons like Aaron and I, but for within the medical field, like, you guys kind of know?
No, I don't think there's much debate about it in the medical field.
So it is just amongst us idiots, is what you're saying. You're very nice, Doctor. You're very nice.
Hey, I actually want to ask you a little bit something about your history. I'm looking on the website here, and, of course, you can see Dr. Kannen and a lot of the great doctors at Florida Orthopaedic Institute and, of course, in connection with Tampa General Hospital. But I know you worked for a little while as a team physician in Major League Baseball, also in minor league baseball. How is it dealing with professional athletes in that setting where you're a team physician versus, patients that you see at Florida Orthopaedic Institute? Are those guys kind of a pain in the butt?
No, during my time with those teams, those players were great. We kind of my role was, this was also during some of my training, and my role was to do a lot of the physicals and entry physicals, so we evaluate to see if they're ready to play. Those guys were great. I liked being in that environment. They're very motivated, so usually the athletes are very motivated to get better and to deal with any issues as quickly and efficiently as possible. So that also helps to have that in an athlete or a patient.
So aftercare being so important, I guess maybe I had it completely backwards, right? Because a lot of times normal patients or people that aren't in professional sports or aren't athletes, we're not always as great as keeping up on the aftercare, are we?
Yeah, it's also, each person has their own goals and, things that they want to do. And if you're working as well or, family, you don't have as much time to dedicate to, doing things. But all that, is very individualized. And that's, we also look at all that whenever I'm treating a patient.
Dr. Jeff Kannen joining us right now. It's our injury report, Tampa General Hospital in partnership with Florida Orthopaedic Institute. I got one more for you. I want to get into the Buccaneers. Cam Brate is dealing with his neck injury, really considering what we thought on game day when he was carted off. Things look much better than we anticipated. But with the neck injuries, obviously you have to be extremely careful with them. But when we're talking about a sprained neck, a best-case scenario with that injury, how delicate do you have to be, and how much concern goes into an injury like this?
Yeah, I saw this injury when it happened, and I was concerned. He was on the ground. The medical staff immediately took care of him and evaluated him. Typically in that situation, if they have any spine tenderness, they immediately start a protocol where they immobilize the neck, make sure that all the extremities are working, and then they put them on a board and take them off the field very carefully. That's standard protocol with any neck injury. They're immediately removed from care. They're usually taken to be evaluated further. In his case, he had it looks like a cervical sprain. That's where some of the ligaments in the neck can be either stretched or injured, and it can take anywhere from a couple days in very mild cases to a few weeks to kind of fully recover. I understand he had a concussion a few weeks ago too, so they'll also evaluate him for that to see if he has any new concussion.
Hopefully it continues to be the best case scenario for what looked really initially very, very ugly, and it's been a rough month plus for Cam Brate. That's the injury report here on the Pat and Aaron Show, presented by Tampa General Hospital in partnership with Florida Orthopaedic Institute. They provide you access to one of the top orthopedic programs in the nation. Schedule that appointment today. Don't wait any longer at floridaortho.com. Thank you so much. Really appreciate joining us. Appreciate you joining us today, Dr. Kannen.
Absolutely.
Thanks
for
Doc.
having me.
All right, when we come back, and every week we'll have a doctor on from the Florida Orthopaedic Institute in partnership with Tampa General Hospital.